On today's episode of Treatment Talk, we're going to be talking about allogeneic stem cell transplants. As of October 5th, 2020, 21 AlphaCure participants have received an allogeneic stem cell transplant. Before we get into the details, let's talk about some important terms to know. Engraftment is when transplanted cells start to grow and make healthy blood cells in the recipient's body. Graft rejection is when transplanted cells are destroyed by the recipient's immune system. Allogeneic stem cell transplants help replace the diseased bone marrow of a myeloma patient with that of a healthy individual. To learn more about the role of bone marrow and stem cells, you can watch our Treatment Talk video on the autologous stem cell transplants. Prior to an allogeneic stem cell transplant, the patient goes through HLA matching to find a donor, and the donor's stem cells are collected. HLA, or human leukocyte antigens, are a series of proteins that are found on the surface of most cells in the body. They help differentiate which cells belong in the body and which ones don't. During HLA matching, a patient's cells and a donor's cells are tested to see if they have a close match of HLA proteins. HLA matching helps reduce the chance of graft rejection and other complications. Once a donor is found, they will get their stem cells collected. Now let's see what happens with the patient. First, the patient goes through conditioning to suppress their immune system to help with engraftment. One example of conditioning is receiving low-dose total body irradiation and fludarabine. Then the donor's previously collected stem cells are infused into the patient. The stem cells will find their way back to the bone marrow and start making new healthy blood cells. The reason for using allogeneic stem cell transplants in myeloma patients is based on the hope that the donor's immune system will recognize and kill any residual myeloma cells. However, this effect is less pronounced in myeloma patients when compared to patients with other blood diseases. A common complication with allogeneic stem cell transplants is GVHD, where the donor's immune cells start to attack the healthy patient cells. Acute GVHD typically involves the skin, intestines, or the liver. Chronic GVHD can also affect these organs, as well as cause some joint and muscle problems, dry mouth or dry eyes, and tightening of the skin. Have you ever had an allogeneic stem cell transplant? Share your experience by commenting down below. Thanks for watching this video. To see our other videos, go to alphacure.com.